Hi there, my name is Nicole and I'm making this video to talk about some butt problems that I have gone through this year. It's been since May. I started having some issues and basically I thought I had a prolapsed hemorrhoid and I knew that I had hemorrhoids, but I wasn't sure. So I went to see my internal medicine doctor who confirmed that there's something there. She wasn't sure, so told me to seek out a proctologist or some specialist, gastroenterologist. So I decided to go with a proctologist, and luckily with my insurance, I don't need a referral, so I could just pick one that I found in my network, and I found a proctologist by the name of Dr. Woody in Denver. He had really good reviews. You know, I was just reading a ton of reviews and decided to go see him. I went to see him, and the worst examination I've ever had in my life was horrible. I think that would pretty much what most people would say. That doesn't make him a bad doctor. It just is not a pleasant experience. So he discovered that I had his words, a nice size fissure and a couple of hemorrhoids. So he couldn't fully examine me because it hurt so much. So he was able to reach one of the hemorrhoids and inject it with something that shrinks it, basically, because it was a smaller hemorrhoid. And then I was scheduled to come back in a couple of weeks to have another examination so he could further examine me, because he couldn't see everything. In the meantime, he gave me some medication that's it's called DILT, D-I-L-T, I believe. It's got lidocaine in it. It's a cream that you put up your rectum, their words, a knuckle size, and swirl it around. Not fun, especially if you're in pain. It did, however, help, and it made it feel better. And by I guess it was like 2.5 weeks later, I was starting to feel a little better, but the bulge was still there. And he described to me what I thought was a prolapsed hemorrhoid really was. So when you have a fissure, a tear in your rectum, your body wants to try to heal itself, which is a good thing. It creates a skin tag at the very end of the fissure that basically will pop out the end of your rectum. So I thought it was a prolapsed hemorrhoid, but in fact, it was a skin tag from the end of the fissure trying to heal itself. So 2.5 weeks went by, I went back, and he was going to treat me for the other hemorrhoid. The examination was still pretty horrible, but not quite as bad as that first time. He was able to do the banding on my hemorrhoid, which I'm not sure if you're familiar with that, but it's basically a device that they put up your rectum, and it puts a rubber band at the base of the hemorrhoid, because this one was bigger, so it qualified for the banding. So they put a rubber band at the base of it, and it basically, you know, just cuts off the blood supply, and then it eventually falls out and comes out. So I got those dealt with. And then I continued on. He was like, you're not healed from the fissure. Keep using the cream. So I did. And then, you know, it was like about a week later, I was kind of in a little discomfort from having the banding done and just him examining me again. It was just like a little irritated. So he had told me initially to take 2 cups of Epsom salt into 4 to 5 inches of water in a tub, and sit in it for 20 minutes every time you have a bowel movement, or just if you're uncomfortable and you just need some pain relief. And so, you know, I was doing this like 3 times a day. And then by the time he did the banding, and a week later, I started experiencing a different type of pain on the right side of my rectum. Originally, all the pain came from the left side. This time it started on the right side. And I was like, why am I having pain on the right side now? This is weird. I wonder if it has something to do with the banding. You know, I was just on YouTube constantly trying to find answers. that was rather challenging because there wasn't a lot of videos out there with females talking about their butts. It was mainly like, I did find a few videos with men talking about their butts, but it didn't feel like people had like the issue I was having. And so I decided, you know, okay, I'm just gonna keep on researching. So that's what I did. And I would just take lots of baths and was constantly doing exactly what Dr. Woody told me to do. I guess it was like another week had passed and that pain had gotten even more excruciating. I don't know, like in my mind at the time, I was just like so baffled. I was like, I thought that I would be getting better. Like, why am I not getting better? You know, he gave me medicine. We did the hemorrhoid thing, like all this stuff. And I'm getting worse. In fact, it was like worse than ever. It was like horrible feeling. And I was taking a bath up to like 6 times a day, trying to relieve this pain I was having. It was like a burning, stinging, pinching pain. It was unreal. So I called him back and I was like, hey, you know, and I explained that I was in worst pain ever. And he decided to go ahead and you need to get on the books with a surgeon. It could be a month before you see one. Let's go ahead and get you an appointment with a colon rectal surgeon. So I was fortunate enough to like, I think it was like Dr. Bennett is who I saw, but I was fortunate enough that he had a cancellation like that next day. So I was like, yes, go. So I went and he did not examine me. He did look on the outside and, you know, I told him everything that I had been through with Dr. Woody. And so he then gave me my options and they were to do a fissure debridement with Botox and anesthesia. So it's just like a fissure cleanup. They clean up the fissure, medicate it, whatever, and then they give you Botox to relax your sphincter because your sphincter is like this all the time and it will not relax enough to let the blood flow happen. So I continued using the medicine that Dr. Woody gave me throughout all of this, and which was great, you know, to have. But then I felt like after a while, the effectiveness was wearing off. So I didn't feel like that was helping very much. So to help relax things down there. So I was interested in the Botox. Obviously, that's the first thing he told me about. And then there was the sphincterotomy you could have where they snip your sphincter to where it just cuts that little muscle for good. And then you don't have like the muscle spasm so much and things have blood flow and it will heal. And the third option was like a flap surgery where they take skin from like next door and basically cover the fissure with like the skin that they took from next door. That sounded pretty horrible. So of course I'm gonna go with the Botox first. That sounds like, you know, the easiest way to go, less invasive. Give it a chance to heal that way on its own. We did that August 1st. And before I move further, I will say that I bought myself a bidet. I got it on Amazon for like 40 bucks and I will never not have one in my life again. It is like by far like the best thing through all of this that I could have bought. And if you don't have one, go to Amazon and get you one because they're amazing. And you don't have to buy the fancy ones. You can if you want. For me, I didn't buy one that's temperature controlled. It's just cold water and it does not bother me. It's fantastic. Like, I can't believe I've not had one before now. I'm like, where has this thing been all my life? So for sure, make sure you if you can do it, get one. It's super wonderful. And then the little stools that you put under the toilet to put your feet on is also really valuable and important. It really helps a lot during your bowel movements. And then of course the baths. And then the other little tip would be to get a small fan for your bathroom. And then when you get out of the tub or after the bathroom, using the bathroom, you can turn that fan on and just stand it and put it on your toilet, stand in front of it and like dry. So you don't have to touch anything if it's really sore down there. So I bought the bidet like the day before my surgery. I was like, I need this in my life. And I'm so, so glad I did. It was just a huge step in like helping me heal and recovery. So after the Botox, August 1st, it took some time, but I did heal. I healed up, you know, pretty well, and things got better. He did find a fistula when he was in there. So that was a surprise. I knew that it was a possibility. And, you know, I was kind of worried that he might find one, and he did. And luckily the fistula, is basically when your fissure gets infected, it can cause an abscess, and that's what happened. And then the abscess is like full of fluid and it has nowhere to go, and it's just gonna explode. It's just like so much fluid in there that it forces a tunnel through your skin to come out like somewhere at the end of your rectum. Sometimes it could be worse, but mine luckily was parallel to my rectum, or to my anal canal. So he was able to go in and just kind of slice it open, be done with it, don't have to worry about it ever again. And that was the source of where that pain was coming on the right side. It was the fistula, which I didn't realize had gotten, you know, like my fissure was not healing. In fact, it was getting worse. But a lot of times that medication will mask your pain, and you don't always know that it's getting worse, you know. But mine was, and it got infected, got that fistula. But luckily he took care of that while he was in there, did the Botox, cleaned up the fissure, and sent me on my way. So about, you know, 3 weeks later, my bath times got less and less. I was able just to like take a bath in the morning after my bowel movement, and take a bath at night just before I went to sleep. And I got my bathroom visits under control, because I was going to the bathroom 3 to 4 times a day, and that was really hard on the fissure, you know, to like give it time to heal. When you're pooping all the time, it's like almost impossible. So I got that under control, where it was like 2 times, maybe 3, you know, like not 4. So that's good. Now I'm down to like 1, maybe 2, which is even better. So, you know, once you get your diet, because your diet has so much to do with everything, like so much. I eat lots of veggies and fruits. I'm a vegetarian, so my diet consists of like lots of fruits and veggies, and, you know, pretty healthy eater. I don't eat a ton of carbs or sugar, but I eat sugar sometimes, you know, like I'm human, and I like chocolate, and I do that sometimes. I try to, you know, really moderate how much I am putting in my body though, because you'll pay for it later, right? And that sucks whenever you're having problems to pay for it later. So the Botox, like it takes about 5 days to kick in. And when it does, you really notice those spasms. It's just like almost stop. And it just feels like I guess the feeling I could best describe it as is like, it feels puffy down there. It feels like kind of puffy and kind of weird at first. It's like you're trading one thing for another, but it's like, I just felt so much. I felt instantly better after he fixed my fistula. Like instantly, the sharp stinging pain was gone. It was like I traded it for kind of a different pain, which was just more of like a swollen, puffy, weird feeling. And I was fine with that. It's like so much better. And then that got even better too. I was like 2 months into it, I was just back into my normal stuff. I was able to go yoga. I was able to do my disc golf. I was able to do all the things that I love, go walk with my dogs and not feel like I'm in pain. It was really great. Botox, anal Botox usually lasts 3 to 4 months if you're lucky. Mine lasted about 3.5 months. So when it wore off, it was real obvious and apparent that it wore off, because my spasm started back and my fissure is not healed. And so that was, you know, pretty terrible. Started getting bad again. I was taking more baths, and I ended up calling Dr. Bennett, was like, hey, we need to do another round of Botox maybe, because he told me that's a possibility that I could do Botox again. So I decided let's do this again. I met my deductible in my insurance, so, you know, why not? Like, this is not going to cost me near as much as it did the first time. With my insurance, by the way, I have a Cigna, and it cost me, and it's probably different everywhere, I'm sure, you know, but like in Denver, for where I went, with my insurance and everything, I think I paid $1,500, and I would have paid more than that because of the pain that I relieved, and then the fact that he got rid of my fistula. So, was worth it. I don't care. Money is just paper, right? You know, it's like, if you don't have it, then obviously that sucks. But, anyway, so I called Dr. Bennett and asked him, let's do it again. So he's like, okay, we'll do it again. I went and saw him in an office visit prior, and we talked about other options again, revisiting those options again. And I decided, you know, initially I was like, maybe we should just do this sphincterotomy and just get over with. And then he's like, I think we should try Botox one more time. And I was like, okay, so let's do that. So we went in, and this time, unfortunately, he noticed a mass behind my fissure. That sucks. I wasn't even concerned about him finding like a mass, because he was just in there before in August, and you would think he would have found something then, but no. It just, you know, the fissure was probably hiding it. So this time around, he felt it, and he said it was like a dime size. He went ahead and took a biopsy right then and there, and that was November 28th. And so, you know, still waiting, a lot of results, but we do know it's cancer, unfortunately. The pathology report still doesn't really know what type of cancer it is, so he sent it off to a different lab to get a second opinion. Has already sent me to a cancer doctor, Dr. Nella Preddy, and already had PET CT scan and had an MRI scan. And Dr. Nella Preddy is like moving really fast, trying to help me get a treatment plan and take care of me. She's amazing. And Dr. Bennett has been freaking amazing too. I really, you know, so far love them very, very much, both. And they work together. And also Dr. Reiner, who I've yet to meet, but he's the radiology oncologist who I will be seeing next week to set up my radiation treatment stuff. So Dr. Nella Preddy gave me a couple options for chemo. So I'm gonna have to do radiation and chemotherapy for this tumor. So the tumor is, with the MRI and the scans, they've discovered that the tumor is 2.5 centimeters, or excuse me, I said that wrong, 2.2 centimeters. And then it has gone into the lymph node next door. It is 1.4 centimeters. And then they found a teeny tiny spot on my groin, which she's not like super concerned with at this moment until they really know what type of cancer it is. But between her, Dr. Bennett, and Dr. Reiner, they all three got together, look at my scans, and they're all like pretty confident that it is a squamous cell cancer, which is strictly anal cancer, and it's a common one, and it's you know, very treatable. So it's just taken me a while to accept this and to like learn more, and I'm still researching, but hopefully I'll start my treatment in like a week or two, right after Christmas, I'm guessing, which I'll go in for 6 weeks to get radiation every day, 5 days a week, not on the weekend, just Monday through Friday. And it's like 10 to 15 minutes a time. And they basically will, like, they're gonna make these little dots, like somewhere on my backside, where they're gonna hone in with the radiation and just like zap the tumor and nothing else. No surrounding tissue, just the tumor itself, and probably the lymph node, I'm not really sure. And so it's like, it's not really affecting anything else around there, which is nice. And it's very effective. And then they'll also treat me with chemo. So the first day, like the treatments options for chemo were like, I could get a port and then carry around this little IV bag thing for the first week at home while I'm going to radiation, like intravenously, you know, right in my veins in a port. And then the last week, so the 6th week, first week and the 6th week, I will do 5 days straight of this port chemo thing. And then in between, it would just be radiation. Or I could go the first day of radiation, get an IV and just take an hour worth of chemo and then take pills. Like, I think she said, I have to confirm this with her, but I'm pretty sure she said like 6 pills a day. So like 3 pills in the morning, 3 pills at night, and then every day that I have radiation. So I'm assuming that would be Monday through Friday. I'm still yet to get like, you know, but this was Friday, today's Sunday. So I'm still like taking it all in as what my treatment's gonna look like. But I chose the pills, You know, I don't want to go through the port. My mother had a port. She had breast cancer, and I saw what she went through and with the port, and I just, if I don't have to do that, I won't. And my one question was, are these treatments the same effectiveness? And yes, they are, she said. And I did research, and she's correct. So definitely going to go through the pill route. 6 weeks isn't that bad. It's not that bad. But it does explain why my fissure would not heal and why it's there in the first place, because there is a mass there. And, you know, it is very scary when somebody tells you you have cancer. The unknown, you know, of everything is terrifying. You know, if somebody told me I had breast cancer, I would not be as shocked because my mother had breast cancer. I've had like genetic testing done, and I don't have the, I can't remember what it's called. It's like the Barak gene, or I'm totally probably butchering that word, but I don't have that aggressive breast cancer gene. So that's good. So it's just still like, it's shocking nonetheless. I'm really, you know, like a healthy person. I exercise, I eat pretty darn good. I don't smoke, I don't drink. You know, I used to smoke. I quit smoking cigarettes like 11 years ago. And, you know, I used to drink like years ago. Don't anymore. 48, by the way. I probably quit drinking. It's like, I really probably have had 1 or 2 drinks in the last year. Like I never really cared that much about drinking. Anyway, and I don't like taking pain pills. Through the whole thing of all of this, I've only taken Advil and Tylenol. That's it. And I don't like pain pills. I don't like narcotics. I don't like opiates. I don't like any of this stuff. I don't like, you're trading problems for other problems. A lot of times it just makes you tired and you still are in pain. I'd rather feel normal and not be medicated like that. So I'm going to keep going with that idea and try my hardest not to use anything stronger than that. But, you know, if I have to, I have to, but I don't want to. And I'm going to try really hard to like stick with that. If you have any questions, you know, drop it in the comments. I'll do my best to answer. This is all like, you know, still pretty new, but it is interesting. And I feel like good in some ways, because now I have some answers, and I know now like why I have the fissure in the first place, because it was just driving me nuts. It's like, why is it not healing? Why is it not healing? Why am I not healing? You know, this is like, it's ruined my life, you know, like, so it makes sense. But I will say, if you have a fissure and it's chronic and it's not healing, you know, it probably would be in your best interest to get some sort of cancer screening just to be safe, you know, like, why not? It's important to be the best advocate you can be for yourself, because nobody else is going to do that. And this is, you know, like ignoring problems never got anybody anywhere. You know, would like to live for a lot longer. And even though I'm not afraid to die, I still don't want to die, you know. I've got a lot of life to live, so it's important to take care of yourself. Anyways, that is all, but take care of yourself and be well. And like I said, hit me up if you have any comments or questions or whatever. All right, bye.